We'll talk about that later in the show.
Tonight, we are taking a closer look at the newly released data by Public Health to determine which underlying health conditions put people more at risk of dying of COVID-19 and why. 23 ABC's Tori Cooper joins us live from downtown, where she spoke to a local doctor to break down why certain medical conditions pose a greater risk. Tori?
Yeah, Danielle, based off that newly released data by the Kern County Public Health Department here in East Bakersfield that was just released yesterday, which now includes the ages and underlying health conditions related to the deceased COVID-19 patients in our community, we now know that people with hypertension and diabetes are more at risk of dying of COVID-19. And the doctor I spoke to today from Adventist Health Bakersfield says that's consistent with what he's seeing in the hospital. New data released by the Kern County Public Health Department this week outlines just how many COVID-19 patients have died from underlying health factors. Of those, the top two here in Kern County are hypertension and diabetes.
People who typically have hypertension or diabetes, typically they're actually on the obese and they're overweight. So when you do have something like this, like the coronavirus, which is a very respiratory forward infection, and then you do end up being sick because of it, it would be one of those factors that would be affecting the way you breathe and make it harder for you to open your airways more.
Dr. Jonathan Dario of Adventist Health Bakersfield says hypertension can cause organ damage, strokes, and more, even without the presence of COVID. He also says diabetic patients under stress from the COVID-19 virus can be more at risk for blood clots that cause other complications.
Can do worse when they have diabetes, because when you're stressed and you're a diabetic, our sugars typically go out of whack, and you're likely to develop something we call like acidosis, which can also affect your breathing abilities.
Dr. Dario explains that complications that come with both hypertension and diabetes make your fight with COVID-19 much longer, more strenuous, and the odds of surviving are stacked against you. The newly released data from the Kern County Public Health Department shows the majority of patients who died from COVID-19 had either hypertension or diabetic medical conditions and were 65 and over. The data also shows 12 people in Kern County have died of COVID-19 alone, without any underlying medical conditions. But Dr. Dario says it's all up to the physician examining the person to determine their primary cause of death and put it on the death certificate. And the number 12 may not be entirely indicative of what's actually happening in our community.
It's hard to just use death certificate data or reported data as this is the only cause to say that, because they could still actually have underlying conditions, those 12, or they could be completely healthy people, but they just might not be reported in that portion of that certificate.
And because there are other certain respiratory effects from COVID-19 that may lead to other health issues.
Because it's not necessarily they might not be, maybe that physician doesn't think it's a causative factor to their death. It's just something that's chronic for them.
Now, officials here at the Kern County Public Health Department also told us today that they will not be updating the new portion of the COVID-19 dashboard daily that now includes the ages, ethnicities, and other details related to the deceased COVID-19 patients in our community. They told us this data does take time to gather and therefore update the dashboard. And as soon as they get that information, they will bring that to their website where you can view it in real time as soon as they get it. But we also reached out to the Kern County Chief Administrative Officer, Ryan Olsop, to see if he believes that the county should still be shut down, considering that we now know that only 12 people in our community died of COVID-19 alone, and he did not get back to us. But of course, we will continue to push for these answers and bring you the very latest details here and on our website, turn to 23.com. Reporting live in East Bakersfield, I'm Tori Cooper for 23 ABC News, connecting you.